into universal alphanumeric. Alphanumeric because some of these numbers, they are not only the numbers, they uses the alphabet also. So some of the codes we write A41.9. So that's the code for one particular kind of diagnosis. So that's why we use the term alphanumeric codes. The diagnosis and the procedural codes are taken from a medical record books or documentation, such as transcription or physician's note or lab and radiological result. So that's why whatever the doctor writes, the documentation of the doctor, it goes back into the medical coding department, and there they read the report or the documentation, and depending upon whatever the diagnosis is and whatever the treatment the doctor has told, they will give a number to that particular report, medical report. And those number, then they are forwarded to the insurance company. Insurance company will see, okay, what is the plan of this patient and whether... Yes. So, depending on that, the insurance company will... I think somebody's background is loud. Okay, so most people didn't know that the kind of coding terminology exists in the medical field. Medical coding requires the knowledge to understand different anatomy and diagnosis. I think somebody's...
Yes, madam.
Can you mute
all participate unmute?
Yeah. Can you do that, because otherwise it will be difficult. Medical coding requires the knowledge to understand the different anatomy, physiology, and the diagnosis.
Can you please unmute that, man?
Yes.
Actually, I can't hear you. That's very disturbance in your background.
No. Now I think we have told the participant to mute the thing.
Okay, ma'am. Thank you.
Now can you hear?
Yes, ma'am. Yes, ma'am.
So basically, since the medical coding it deals mainly with the medical field, all the students who are taking in this particular field, they need to know what all the medical terminology. Because suppose if the doctor has written that the patient required the colonoscopy, and if you do not know the meaning of the word colonoscopy and you write different number to that colonoscopy because you don't know the meaning of that word, then the insurance will deny the claim. Because insurance will say, suppose for example, let's say the patient has abdominal pain. So that is something to do with your abdomen. And you wrote the treatment about the fracture. The insurance company is going to deny that claim because the patient had abdominal pain for which you have written the diagnosis code, but your treatment code says the fracture, repair of the fracture. So that is, no way related to each other. Abdominal pain and the treatment of the fracture, and the cast is given. Suppose you have written the code for that. The insurance company will deny the claim because you have not written the code for the appendectomy, but you have written the code for the fracture. So that's why as a student, you are supposed to have the good knowledge of the anatomy. You're supposed to have a good knowledge of the physiology, and you're supposed to have the fair knowledge of the terminology. And as in when you go deeper into this particular field, you will understand more and more, because then you see those terms regularly. Okay, so this is about the medical, what is the medical coder needs to know in this field. Now, what is the importance of this particular field? The importance is the medical coding is very helpful system that plays a key role in modern healthcare operation. In recent times, it also allows the organization to communicate effectively with each other and also the healthcare system throughout India and the world. many times what happens nowadays in the very big hospitals in India also started following the diagnosis code, that is a ICD-CM code. Now, how does that help? Because all these hospitals, whenever they come get the patient, they start writing that number, and automatically we create a data. So by seeing the numbers that at the end of the year, our healthcare's health ministry, or even the American healthcare ministry, they get the numbers. Okay, diabetes numbers are, let's say, 200, but hypertension numbers have become 1,000. So from that, even it helps the country also to find out, okay, that the hypertension is increased recently in the youngsters. Okay, so that helps also, not only hospitals, not only the small doctors, also help the country to keep a tap of their health. So this is a very important thing as far as the medical coding is concerned, because these codes are universal. So everybody can write the same code for the same condition, and anybody can read those codes. Then what are the job opportunities? Now, as far as the job opportunities are concerned, either you can work in the hospital.
Background noise.
Excuse me, can you mute the noise, mute the mic, please? Yeah. Thank you.
Please, friend, all mic mute, please.
Please mute the mic, please. Okay, so the job opportunities are hospitals. Many these hospitals and the small group practice send their work to India, the back-end work to India for the medical coders. And so we get the patient, doctor. Can you please mute the mic?
Ma'am,
Ma'am, we can't hear you
there
because
is no,
background noise is much more.
ma'am, there is no option to mute in your phone. You can
Yeah,
mute. You are the host now.
I think I can do that. Let me just do it.
Do
That will
that.
help me. Okay. So till I finish my lecture, I'm all the participants.
That is an option.
Pardon?
There's an option. You can mute people. You are host now.
Yeah.
Remove.
Okay, now I think I have muted all, and then I'll unmute all later. So if you have any questions, you please write it down in the chat. Later on, I'll just check the chat. Okay, so that there won't be any background noise. So the job opportunities are in the hospitals, because the hospitals, the physician office, that is doctor's office, they all send their work to India. Even the insurance company, they also send the works to India, because the insurance company also require the coder to find out whether the codes are written by the hospitals and the physician office, they are in the correct order. Because for one patient, there need not be only one code. There are multiple codes, and there is a way we write those codes in a particular order to get the maximum benefit. So the hospital is going to write in a particular order, but the insurance company also recheck those codes whether we have written them correctly or no. Then the government agencies. In America, there are certain insurances which are actually given by the government. They are called as a federal insurance, like Medicare and Medicaid. Medicare policy, insurance policies for everybody who's above 65 years of age. In that policy, now they have included many handicapped people who are below 65 years. And then there is a Medicaid policy, which is a state policy. So for that also the government requires a coder who will work for the government, because this Medicare and Medicaid insurance claim directly goes to CMS, that is the Center for Medicare and Medicaid Services. Then you have outpatient surgery. Now many surgeries in US that does not require the hospital administration, the smaller surgery like drainage of abscess, or for example the sutures, 3-4 sutures. Suppose you got hurt and you have a small wound, so and sometimes the doctor says no, we need to suture the wound. Those are all called as a outpatient surgery. Outpatient means you are not admitting the patient. And then the health consenting, and all these are the job opportunities for the medical coder. Requirement for the medical coding. Now what is required for the medical coding? You require the health information technology, the thorough knowledge of that. Then ICD code, which are the diagnosis code that you require a thorough knowledge. The CPT code, which are the treatment code. Then the inpatient coding. This is slightly difficult coding, but of course it's a matter of mastery. This is mainly you do it for the hospital. And then the customer billing. The billing, the coder and the biller, they work hand in side by side. I mean, the coder will generate the code, the biller will generate the bill. Then the outpatient coding, I told you. Outpatient coding, it has two parts: outpatient surgery as well as the outpatient, that is the doctor's office visit. Then you require a thorough knowledge of physiology and anatomy, because there are certain confusing terms in medicine, like appendectomy, or you can say colonoscopy, colonostomy. Stomy just a opening, scopy is viewing. So if you know this medical terminology properly, if you know the anatomy, physiology properly, you will do the correct coding. If you don't know the terminology and physiology properly, you will always end up doing the incorrect coding, and too many
Excuse me,
incorrect
ma'am.
coding.
I have a doubt.
Yes.
Actually, I want to know that the anatomy subject is how much importance in medical coding?
Anatomy, you need to have a fair knowledge. Like suppose, I'm talking about the lungs, you need to know where the lungs are.
Yeah,
The ribs, you need
that's
to
a
know
not
where the ribs.
anatomy, just a general knowledge, that's all.
Slightly more than general. I mean, general is lungs, even the layman will know where the lungs are. But you will have to know not only the lungs, there are, if there is a one-side lung or two-side lungs, and what are the lobes of the lungs, all that.
Actually, I am already joined the medical coding in another institution. Then now I am starting the anatomy. I am the engineer. My previous degree is an engineering field. That's why I'm totally different. Now I am very tough to teach anatomy. That's why I ask you, anatomy is most important subject of medical coding.
No. So you must have learned biology till 12th, right?
Yeah.
So you have a fair knowledge of anatomy. So you don't require what we learn in medical colleges. Actually, I mean, our knowledge is not.
It's very deepest study in anatomy in our institution. That's why I'm asking like that in the operation, surgeries, pharmacology, cancers. That's very deepest studying.
No. See, it depends. Initially, when you join as a freshie, as a medical coder, you require a fair knowledge. I won't say you don't require a knowledge at all. You definitely require a fair knowledge of the subject. But I mean, as you grow, because when I was teaching at a medical coding institute also, I had a lot of students who are from not from the biology background. So initial few 2-3 months are difficult for them, but otherwise they also pick up anything. Finally, it is knowledge, and anybody can pick up this.
Okay, ma'am. Thank you so much.
Only thing is, I would suggest, since you are not from the biology background, keep your eyes and ears open.
Now I'm in a previous degree in engineering in IT.
So you have a good knowledge of IT, na?
Yeah, I know. Actually, I joined the medical coding and institution. That institution teach me the anatomy is very deep. That's why I asking you how much importance is anatomy in medical coding.
No, not very deep, but I won't say I mean, you can have a layman's knowledge. Your knowledge should be slightly just below the doctors, and that comes. It's nothing very difficult. See,
Yeah.
because engineering is a concept understanding. Medicine is all about what you see. You have to just
That's
know.
a different field. Medical fielding and engineering.
No, but the thing is, engineering many terms I won't know, but medicine even the layman knows. Oh, running nose. Any layman on that road also will tell what is running nose is.
Actually, now I'm
So,
starting.
I mean,
Yeah.
many times you will hear regularly also.
Yeah. Thank you, ma'am.
And it is like learning a new language. If somebody tells me to learn a new language,
Yeah.
I'll have to take some extra efforts, right? I won't be getting that language by sitting just, okay, I want to learn. I'll have to read that language 10 times, then only I'll get it.
Okay, there is a
So,
pathologist.
yes, there is a pathology. There is
इंजीनियरिंग तो ज्यादा ही बेरोजगार हैं.
Yes.
Yes.
Excuse
Can
me.
you repeat? Yes.
So many pathology studies nowadays in anatomy. That's very important. We all know knowledge in all pathologies in different organs in one mouth. For example, mouth I have studying the too many pathologies like kidney, lungs. We all knowledge in all organs, all pathologies.
Yeah. Pathology is basically the diseases. Patho means disease, and study of diseases is pathology. But that also, many diseases, malaria, pneumonia, Now, like pneumonia is related with the lungs, that right?
Yeah, I know.
Yeah. So the beauty of this field is most of the names you have heard continuously surrounding your area. Somebody says, oh, I'm having cataract. You won't tell, oh, show me your hand. Is there a cataract? The cataract is related with the eye, right?
Okay, ma'am. Thank you so much.
I'm MSc Biochemistry student. Can I join the course?
Yes. Can you repeat the question, please?
I'm MSc Biochemistry student.
Yes, you can join.
So, this course is my personally professional helpful.
Yes. Anybody. In fact, we always preferred a biology background, but there are quite a few students who are not from a biology background also did really well in this. And the person who's not from a biology background, if she can't pick up coding, she can go to billing because those things are parallel. I didn't get the name of that student who asked me the question. Yes?
Course fees structure, ma'am.
I think we have a counselor from Henry Harvin side. That person will give you the details about the course fee structure. I'm here to just tell you what the medical coding and everything is and the curriculum.
Okay, ma'am. Okay.
Yeah?
Hello, ma'am.
Yes.
Good afternoon, ma'am.
Good afternoon.
Ma'am, I have done PharmD, ma'am. So I want to know that. Hello, ma'am. Am I audible, ma'am?
Yes. Now I'm audible.
Ma'am, I want to know that suppose I have enrolled in this medical coding course. After that, are they ensuring as a placement?
Hello.
See, it all depends on, we have various medical coding institute in South and in North. And if you are good at it, after your interview, they will take immediately to those companies, and then you can go. It's like, any IT field. You start as a medical coder trainer, then you have a quality, you move to quality analyst, then you become a team lead and the process lead. So depending upon the experience, you go up the ladder. So that's not an issue.
Okay, ma'am.
Yeah. The biology background helps you because your bases are already clear. But the non-biology background, they can pick up medical billing also. Coding is also, I won't say, because I think I forgot the name of that student she asked, who's not from a medical biology background. For her, medical billing is also equally good. who was that student? I can't see the name of all the students. And let me just. Okay. Okay. Now, as far as the curriculum is concerned, we we have like 90 hours of course, and in that what we teach is what is the World Healthcare. I mean, how does the US and the other World Healthcare operates? What are the different medical terminology? That is a very important part of this course. And then we definitely give them understanding of various systems. Like, we talk about, there is the anatomy and physiology where we teach them little bit about every system, the digestive system, integumentary system, reproductive, respiratory, cardiac, all the systems. So we give them fair knowledge of that. And of course, then it depends on the student how much he can read, because it's a 90 hours course. So we guide the student in taking, what is necessary for the anatomy and physiology. And of course, we provide them with enough material. If the student has an interest that, yes, I want to read it more, then definitely we provide them that material too. Okay, so our presence is there where we, we deliver the instructor-led training to the client base. We provide the training to all the clients. We provide the training to many MNCs also. So this is as far as the medical coding is concerned. And 19 hours live training session. We conduct a boot camp session. The boot camp is basically if you want to give the CPC exam. CPC is basically the professional coder exam, certification for the professional coder exam. And for that, we provide the boot camp. Boot camp means the crash course. Nowadays, before any exam, you take a course for a month or so. So in that, we guide the student, okay, this is the way you need to approach this question. And so the program fee includes your 19 hours live training session, boot camp, membership to Henry Harvin writing. Yes. I think somebody raised the question. Yes.
Please continue presentation, ma'am.
Yeah. Okay. So, and then we provide a medical coding internship or the job placement. So this is as far as the medical coding course is concerned. And now we can take up the question in case you have any questions.
Hello, ma'am. We want to know about the package, ma'am. What is the fees of the course?
Yeah, the fees of the course, just a minute. I think we have a slide for that. Yeah, so this is the fee of the course.
Please step portion of the presentation.
So in this particular fee, we will give you the ICD and CPT books. This ICD and CPT books photocopy is required when you are taking the training, because when you are learning the ICD, you need to have the code book with you. And once you take up a job with the company will provide that. But when you are taking a training from us, you will require this particular book with you. And that will be given by the institute. And same way, so you will get the 3 sets of book, ICD book, that is for the diagnosis, CPT book for the treatment, and HCPCS book, that is the HCPCS book. That book also is for the supplies. As I told you earlier, that maybe the wheelchair, types of wheelchair, the crutches and all that. And for that also there is one book. So all these 3 books are provided to you by the academy. And Yeah, the course will run for 90 hours. So usually we conduct the classes daily, either in the morning shift or in the evening shift for 2 hours, daily 2 hours. So you can, take up a batch which is, convenient for
45
you.
days.
Yeah, 5 days. And I think I believe that we do run the Saturday, Sunday batches also. So in case if you are already working professional and you cannot give the weekday time, you can take up a Saturday, Sunday batch.
Ma'am, who will go for
Yes.
who will go for CPC exam? So institute can train also for that
Yes.
exam.
So yes. So if you have already, well versed with the medical coding course, like what is ICD, what is CPT, and you just want to take the CPC exam, yes, we do conduct the boot camp for that. So we can guide you. Basically, if you have seen the mock test paper of the CPC, you know those questions are very intelligently given, and it's a process of elimination. So we will teach or we will guide the student at how to eliminate the wrong answer. And certain shortcuts like what you should look for in this question. When the time is less, what to do, see in this particular question and how to answer that. So all that is covered in the boot camp or the freshers course before the exam, CPC exam.
The
Yes.
whole syllabus is covered in that of CPC exam.
No, for the CPC exam, we assume that you have a particular, knowledge about the ICD, CPT, and HCPCS. So what we usually do is we give them a lot of mock tests, and then we try and solve it with the students. We give them a lot of shortcuts. Shortcuts in the sense how to get to the answer, not the shortcuts how to get how to clear. That is of course to clear the exam, but in the terminology and in the CPT, how to see those because it's a multiple choice questions and you have 4 to 5 answers, and those answers are also, every answer will have some 6 code, and you have just 2 minutes time to solve that. So how to eliminate what is not required. So all those training we will give you, and that is I think only 12 sessions. So maybe 1 month course, that's enough. Yes.
Okay, ma'am.
Am I audible?
And that syllabus is come from the ICD books and all that books you providing that.
No, but see, I think the student who's asking this question, do you have a knowledge about ICD, CPT, and HCPCS?
No, ma'am.
So then in that case, see the ICD, CPT, and HCPCS book, it's like, your telephone registry. What you see is only the number, and in front of that number, something is written. But how to collect, how to pick up that exact number, that we teach you in this particular medical coding course. And CPC is at the end of this, you give this exam. It is conducted by the American board. And this exam is for 4 hours. You have 100 questions and you have to clear 70%. That is, you have to have 70 marks. Otherwise, you will not then otherwise you don't get CPC certification.
Hello.
Okay, ma'am.
But at the end of this course, it need not be that you have to give CPC if you are really good. And at the end of this course, suppose if there is a placement in some of the company, we can tell the bright student, okay, you need to work on this, and there is an interview coming, go and give it the interview here. Maybe we can train you for that interview. Okay, these are the questions they will ask, and you need to get trained and just go and give the interview, and you will get a placement there.
Is this hello?
Yes.
Is this course recognized worldwide?
Yes, the CPT, CPC is a certification that is recognized worldwide. Even the medical coding course is also recognized worldwide. And if you're going to Middle East, if you're going to US, Canada, Australia, they're all, you require a medical coding course, because if you're going to work in the health industry,
What
because
about
it will help you.
What about Europe?
Europe also, they do take ICD codes, ICD codes. So ICD codes are actually the ICD system is first, started by World Health Organization. So ICD is used all over the world, except in India. But now in India also, the major MNC hospitals have started using ICDs.
Okay, after taking the course, can you work as a freelancer, or you have to join some institute or hospitals?
Yes, you can work as a freelancer, but for that, your previous affiliation with certain medical coding company helps, because there is a lot of secrecy that is required in this health industry. And so unless you have a very good firewall at home, then only the company will allot those projects to you. And unless, of course, you have any contacts in US, then you can work from home. But it requires a lot of, your system should be well protected, because there is a lot of chances that the system get hacked. And there are a lot of medical legal, suits that are filed in US. So most of the companies are, unless they have that kind of the rapport between you and the company, I know quite a few senior who are working from home, but of course they had a prior exposure working in those companies.
Okay.
Yeah, but you get, and in US, if you are settled in US, yes, you can work from remotely.
Thank you.
Yeah.
Hello, ma'am.
Ma'am.
Yes.
Ma'am, so the CPC exam will be the main entrance gateway to enter medical coding field or medical coding domain, as because I'm very new to this domain.
So you can take the medical coding training from the Harvin, and if you are really good after the interview, if you get into any companies, then what happens is many companies also give that CPC certificate, or you can take it from outside and join the company. If you are CPC certified, your salary is more than the non-CPC certified student. That's for sure.
Okay. So normal people, like without CPC certification also one can enter, but with CPC certification, the weightage will be more, right?
Yes, yes. Because then, the company pays money to train you, because you are absolutely new, you don't have any knowledge. But if you have taken, suppose you have taken training from us, Harvin, which has a reputed name in the industry, they will say, okay, we are okay if you have not taken CPC training, as long as you have done the course from this.
Okay. All right.
So,
and ma'am,
yes, go ahead.
Please
go ahead.
All right.
No,
ma'am,
you
actually,
ask.
I did BMLT, Bachelor's in Medical Lab Technologies, and I did my BSc in BMLT, and now currently I'm pursuing MSc in microbiology. So I'll be finishing my degree by end of this year. So am I eligible to do that? Anyone can enter, or there are
101%. In fact, I can tell you that since you are in BMLT, see, the initial is a medical coding, which is similar, which is same for all. But then we have advanced medical coders. The advanced medical coder require the very deep understanding of that subject. So if you are from a BMLT, initially you can, join as a fresher in any company. But you can tell them, since I am from this BMLT background, you put me into advanced coding of pathology department, and they will put you, because they see that because you already have the knowledge, what is chromatology and all that, they directly put you into that. And in fact, there is a very high chance of getting the team lead and process lead also, because that requires a very good understanding of the subject.
Okay.
Yeah, what are the different pathology tests, what are the group tests, what is a single test, what is a biopsy and all. So that knowledge you will already have more than the remaining people. So they will put you, okay, you want to take this particular advance, and then they train you, and then you will just do the pathology coding.
Fine.
So, your previous, any knowledge, any hard work which you have done earlier will never go waste, is what I always tell them.
Sure. Thank you so much, ma'am. Thank you so much.
Yeah. Anyone else? Anybody has any other questions? Please go ahead.
Hello, ma'am.
Yes.
Ma'am, actually, I completed paramedical DMLT, ma'am.
Yeah. So good. Very good. Huh.
Okay. Okay. Actually, I've done now this medical coding, ma'am.
You have already done the course?
No, ma'am. Actually, I've done only paramedical DMLT, ma'am.
Also, you want to do the medical coding course?
Yeah, ma'am.
Okay. So you, yeah, I mean, see, any biology background, we prefer because, I mean, we assume that you have a basic understanding of a lot of things.
Okay.
Yeah. So then, you know, you can go ahead and enroll for this course because it will help you.
Okay, ma'am.
Because what we look for is the good understanding of the subject and knowing from the. So we have a lot of BMS. Yes. Okay, so BMS,
tell me.
BMS is doctors. Anybody, you know, take up this course and go, you know, join the. I think somebody's.
Ma'am, this office is in Hyderabad, ma'am?
Pardon? I think you can enroll. They don't have the offline. We don't have the offline courses. We have mainly the online courses. But if you're from Hyderabad, Hyderabad has a lot of medical coding companies.
Yeah,
Hyderabad, Bangalore, Chennai and Kerala is the main hub for all the healthcare companies. And Noida is coming up big time. And Pune and Bombay is another one.
Okay,
if you're from,
ma'am.
if you're from South, immediately after the course, you get the placement also because there are many companies here.
Okay.
Yes.
Okay, thank you, ma'am.
Hello, ma'am.
Yes.
Hello, ma'am.
Yes, go ahead.
Ma'am, I am done my D pharmacy recently.
Can
I also join this course?
Yes. Why not? Pharma, patho, anything, microbiology.
No. Question is what? D pharmacy, B pharm not just doing
it's a diploma in pharmacy.
Diploma in pharmacy.
So what? You have a good knowledge of the medicine.
Yeah.
Anatomy. They teach you.
Okay. No problem.
I mean, you have a knowledge of even drugs also. What is metformin, why it is given and all. What are side effects? What are the all those things are better with you people. Adverse effect. What is side effect? How to look at the table.
Yeah.
I mean, in fact, people who have a very good understanding and from Bachelor of Pharmacy, BAMS, BHMS, dentistry, medicine, even this radiology technician, they also take up this course. It will not be that.
Okay.
What are the course timings? Are they flexible or?
Yes, since it's an online course, you can pick up the batch according to your convenience. So there are batches in the morning, there are batches in the evening, there are batches on only weekends, there are batches all days in the weeks.
Okay.
Hello.
Yes.
Hello.
Yes.
My question is the CPC certification.
Yes.
There is a fee. These are included in your package.
Fee for including which fee?
CPC exam fee.
CPC exam fee.
I believe, I think my counselor will be able to answer this question, but no, we don't include the CPC exam fee in that.
Okay.
Yeah, but you can inquire.
It is a basic medical course.
But
it is a basic medical coding course.
Basic medical coding course, yes.
Okay. I thought is CPC certification is included in your package.
No.
No.
CPC certificate, but our Hendry Harvin certification is accredited to AAPC.
AAPC.
हाँ वो तो आ चुकी है मैम. So we don't
Okay, thank you, ma'am.
Hello, ma'am.
Yes.
Ma'am, what will be the starting package salary for a fresher after completing medical coding certification?
So if you are a trainee, it starts with I believe 21 to 20,000, and once little bit of more experience, then it if you are a CPC certified, it goes to from 30,000. If you are a quality analyst, it is 35 to 50. Then if you are a team lead, then it becomes still 60. So it goes on that way.
Okay, thank you, ma'am.
Yeah.
Hello, ma'am.
Yes.
Hello, ma'am.
Yes.
Ma'am,
Hello.
No, your voice is breaking.
Hello.
Yes.
Hello.
Mr. Rav, can you just
Ma'am, they are not muting the
Ma'am, you
mic.
can mute Ran Noor.
I can mute now?
Yes, ma'am.
Okay.
Yes, ma'am.
I did. Okay. Go ahead. Now who wants to ask the question?
Hello, ma'am. Ashok
Hello,
this
ma'am.
side.
Yes. Go ahead.
Ma'am, actually, I'm BA pass from Delhi University, and I am in a US healthcare process in Gurgaon, and I am in a claim adjudication team. So, can I also join this course?
You are in
Because
claim, so you can take the exam in medical billing.
medical billing.
Yeah. You are already in claim department, right?
Right, ma'am. I'm in a claim adjudication team.
For the US healthcare?
US healthcare process in Gurgaon.
So then, I mean, you already have so much of knowledge. Just take a medical billing exam.
Medical billing exam. So,
yeah, or you can do the risk management also. Nowadays, CRC exams are also very, very in thing. And if you have a fair knowledge, just go deep into that. I mean, you can take up medical coding, no doubt about it. But you are already, a specialist in one particular domain of billing, then go deep into that, no?
okay. So, it's better for me
Hello,
to
ma'am.
do a medical billing course.
No, I mean, see, I won't stop you from not taking the training. Of course, you can take because you
Yes,
have
ma'am.
the knowledge also, and it will
Yes,
give
ma'am.
you, two, that you are coder as well as the biller. Of course, it will improve your profile, no doubt about it.
Okay.
Look
Thank
for
you.
CRC also, because you have a good domain knowledge. Then look for CRC. Take a medical coding course, and CRC is what I will suggest you big time.
For CRC.
CRC is the risk management. Nowadays, quite a few of these medical insurance companies are, looking after reducing the, their spending. So the audit. So they require an audit, right? And since you have a medical billing knowledge, you can go for the auditing also. That's also a very good area and very, very promising. But you can take medical coding, no doubt, because you are already into that field. What is your previous background? Is it a biology background?
No, ma'am. Actually, I'm from art side.
I
completed my graduation from Delhi University in Bachelor of Arts. That's why I'm from non-background science side.
Okay. So try and do the medical billing. That's also very good area.
Okay, ma'am.
Yeah, I mean, coding also, I won't say no, but
yes,
I think somebody was trying to ask.
Hello, ma'am.
Can we learn this? Can we learn in this course practices also about coding?
Practices means what?
About medical coding.
So we teach you that. So what I will teach you is how to select the code, why this code is important here, and how to look up for that code. Because finally, the book is like a dictionary. From that, you can't be searching. I mean, there are some 80,000 codes. So if the doctor writes the patient has rhinitis, I will teach you how to look for rhinitis, which rhinitis number is correct and which rhinitis number is not correct, and why you should write this number first and not that. So all that I will teach you, or whoever your instructor is.
Okay, ma'am.
Hello, ma'am.
Yes.
Ma'am, I have a question.
Yes, go ahead, Sweta.
I am a doctor by profession, and now I'm planning to change and look at some back-end process in medical field. So where do you think is the best I can start from?
So, I mean, if you are a doctor, there's a very good chance, because they, after the medical coding, once you get placement into any coding company, they require the editors and even auditors, that whether this particular case is written well, documentation, for that they require doctors. So it's a good field for the doctors also, and there's a lot of scope. And you can take up any advanced coding also, or inpatient coding, which is difficult, but it's a very big emerging market in India. But since it requires a thorough knowledge of medicine, not many will go there. So inpatient coding is also a very good area where they actually do the surgery coding, and that is for the insurance companies, that's their main bread and butter, because the major chunk of money comes from this surgeries for them.
Okay, I have done my CCS, so I've done my clinical specialization. I've worked as a clinical documentation specialist. So all this is something that I've done. So is there anything else that I can add to my profile and resume?
No. You have already done CCS, right?
Yes.
Yeah, you can do CRC then, risk management.
Okay.
That is very important. Or nowadays, it's home health care is also a big thing, which requires the deep knowledge of ICD-10.
Okay.
And because of the inflation in US, home health care is opened up big time.
Okay,
that
and
you
what,
can.
what
I mean,
do I have
since you have a knowledge, you can directly apply. I mean, are you still working?
No, I'm not. I've taken a break.
So apply, because most of these companies have an age barrier in India.
Okay.
So
and
apply and put your.
Barrier, ma'am?
I think 10 years back they told me 35 years, and they don't entertain anybody above 32, 35. So I mean, for your this thing, entry, because at the entry level, there is no age barrier. But since for medical background, the entry will be slightly at a higher level, where sometimes they do. If they don't have anybody, they do take anyone, not an issue.
Okay, ma'am, when you spoke about home health services, what is the procedure?
Home health care.
Home health care? Is there a separate certification for that?
Yes, there is a separate certification for that, home health care.
Okay.
So you can take up that either course, or I mean, with this actually CCS and all, you should be able to get a placement. I mean, you didn't try, or?
No, I did. I kind of did, but I took a break. So now going back into the field, it's like I'm not getting anything. Or maybe I'm just trying in the wrong place.
No, just I think you need to improve your LinkedIn profile, add 2-3 certifications, that's all. I mean, I would say risk management is important. The audit, that is also nowadays very much in. Risk management, that is also very much in.
Okay, ma'am. Okay. Thank you.
You are welcome. Anyone? Yes.
Hello.
Yes.
Yes, ma'am. Am I audible?
Yes. Audible.
Ma'am, suppose I'm a fresher and I have completed your coding course. So as a fresher, can I get work from home?
Immediately, the work from home is, it's very difficult to get. You have to have some affiliation with some company. Otherwise, if you have any contact in US, they can give you the work. But because of the privacy of this field, it requires a lot of, the security system. The system should be well, it should have this firewall and everything, then only you can. And so that's why initially it will be difficult, but after a year or so you can work.
Okay, thank you, ma'am.
So first, get yourself a job in any company, and then of course you can work your relation with any the team leader, that I want to take a break, will I get a chance of. So they, I mean, if they have a faith in you, they can give you work, because there are many people who are working remotely in this field. But all of them, they had at least 6 months, 1 year experience in the field, because the platform work is very important. Yes. What you learn in the class and what you actually work on the field is very different. And so you have to have that basic training of basic training. Once that is done, then they can give you.
Okay, ma'am. Thank you.
You're welcome. Yes, any more questions? Okay, I need to unmute all.
Hello, ma'am.
Yes.
Ma'am, course is available in offline classes. मैम ऑफलाइन क्लासेस में कोर्स अवेलेबल है?
ऑफलाइन में नहीं है, सभी कोर्सेस ऑनलाइन ही है.
ओके मैम.
तो आपको अगर लेना है तो ऑनलाइन इज इजियर. Our institute, I don't think we provide offline classes. We provide only online classes.
Okay, ma'am.
Yeah. Any more questions or?
Hello, ma'am.
Yes.
Hello.
Yes, go ahead.
I belong mechanical branch engineering field. So I eligible for this course?
There is no such thing like eligible, non-eligible. We prefer a biology background, but if you have a stomach to learn something new, you can take up a course, because हम ऐसा एडवर्टाइज नहीं करते कि नॉन बायोलॉजी बैकग्राउंड ले ही नहीं सकता है, बिकॉज एवरीथिंग इज न्यू. जैसे आपने मैकेनिकल किया वैसे you can learn this also, no, biology also. Why not? I mean, it's a learning.
जैसे मैंने अगर इंटरव्यू में अगर बैठते हैं हम, ठीक है मैडम, जॉब इंटरव्यू में जब बैठते हैं तो वहाँ बोलता है वो हमारा सर्टिफिकेट देखेगा, बोलेगा अरे आपने तो इंजीनियरिंग की है, फिर इसमें ऐसा क्यों डिफरेंट, बिल्कुल अलग हो जाएगा ना मैडम। तो
नहीं, बट आप तो उनको बोल सकते ना कि आप मुझे क्वेश्चन तो पूछो, एंड यू नो people will say कि अरे आप ये बैकग्राउंड के नहीं है, but you have to tell them कि you ask me question and if you are not satisfied then you don't hire me, it's a different thing. But ऐसा तो कोई नहीं करेगा कि आपको कैंडिडेट इंटरव्यू के लिए बुलाए, ऐसे मुंह पे कोई नहीं बोलता है कि अरे आप तो मैकेनिकल बैकग्राउंड के चले जाओ. इनफैक्ट they will see कि in spite of your mechanical background, if you have done the course, anybody will have a respect for you. Okay, you have taken that additional effort to learn this particular course, so they will test your knowledge more कि आप सही में बोल रहे हैं कि ऐसे किया है, कर रहे हैं course. And I can tell you that in my 11 years of teaching experience, I had quite a few students who are from an engineering background. And one student, I tell you, he is in Dubai now, but he is doing exceptionally well. And it's just a sheer hard work. I mean, when I was teaching, he used to ask me any kind of question. And, because he was very...
ओके
डिपेंड्स है आप कितना हार्ड वर्क करते हो. अगर आप में है तो आप कर सकते हो.
यस ओके थैंक्स.
हेलो मैम.
यस
मैम, आई एम फ्रॉम उत्तर प्रदेश, तो माय इंग्लिश इज सो वीक, तो क्या मैम हिंदी में भी सीखा जा सकता है मेडिकल कोडिंग?
नहीं, हिंदी में हिंदी में सिखा सकता है, बट फिर भी आपको फाइनली वो जो कोड देखना है वो इंग्लिश में ही देखना है.
वो तो मैम कोड देखना है इंग्लिश में, बाकी इसे जैसे आपने डायरेक्ट बीच में हिंदी बोल दिया तो उसमें कुछ अच्छा वो हो जाता है ये.
वैसा तो आई एम श्योर सभी ट्रेनर बोलेगा. अभी हमारा हिंदी इतना अच्छा नहीं है, बट थोड़ा बहुत तो आता है ना. अगर कुछ सब्जेक्ट नहीं समझ में आया तो उतना तो हम भी आपको हेल्प करेगा ही.
बस मैम हेल्प की हो सकता है, वो प्योर हिंदी नहीं मैम. मेरे कहने का मतलब ये नहीं कि मैं प्योर हिंदी में, बट जहाँ जरूरत हो वहाँ.
देखो जो मेडिकल नॉलेज है वो तो इंग्लिश में ही है, हिंदी में नहीं है.
जी मैम, वो तो टर्मिनोलॉजी में है ही, वो तो इंग्लिश में ही है.
हाँ ओके. हाँ तो वो होता है, उतना तो सबको आता है. एंड बाकी का हिंदी में तो
भाई नेक्स्ट ईयर कर लेना, योगी जी चेंज करा रहे हैं मेडिकल को हिंदी में. नेक्स्ट ईयर
यू कैन कंटिन्यू
कोर्स इन हिंदी.
नहीं, ऐसा कुछ नहीं है. आई थिंक आपको अगर ऐसा लग रहा है कि कम्युनिकेशन कैसा होए तो दैट्स नॉट एन इश्यू. आप हमारे साथ हिंदी में बात कर सकते हैं, हम आपको जितना समझा सकता है उतना समझाएगा. इट्स नॉट दैट. हाँ ऐसा कुछ नहीं है. आप भी यू डोंट हैव टू हैव दैट इंफीरियरिटी कि अरे मैं मेरा इंस्ट्रक्टर के साथ कैसा बात करेगा. नो, दैट्स नॉट एन इश्यू. हमको समझता है हिंदी, मे बी इतना हमारा फ्लुएंसी नहीं है हिंदी में, बट हम आपको सभी आपका जो प्रॉब्लम और ये होगा, कुछ डिफिकल्टी आएगा, वो आपका बराबर कर देगा. दैट्स नॉट इट.
यस मैम. ओके मैम, थैंक यू मैम.
यू आर वेलकम. सो आई थिंक विल स्टॉप आवर वेबिनार हियर. अगर आपको कोई डाउट्स है, यू कैन ऑलवेज आस्क. Henry Harvin is here to answer all your queries, and then you can register for the course. It will help to brighten your future. Thank you once again and have a good day.
Thank you.
Thank you, ma'am.